It's Dr. Karen with this week's Hot Topic. Make sure you follow us on social media, like this video, and subscribe to our YouTube channel so you never miss another hot topic. So today I want to talk to you about oral hydration therapy, or ORT. So oral hydration therapy is a type of fluid replacement that's used to prevent and treat dehydration, more specifically, especially due to diarrhea. So yes, of course, the poop and pee always comes in there because I'm a doctor. So acute diarrhea normally only lasts just a few days, but that oral rehydration therapy doesn't necessarily stop the dehydration, but it more replaces that lost fluids and essential salts, basically preventing and treating the dehydration and reducing the danger, because when you're dehydrated, there's so many dangers that come with it. So the science of it is pretty simple. So ORT basically combines the ingredients of salts, sugar, and water, and that quickly reverses those symptoms of dehydration. So through that process of osmosis, the salts and the sugars pull the water into the bloodstream, and that really just helps speed up the whole rehydration process along in your body. The sugar or the glucose that is contained in those rehydration solutions, it enables those intestines to absorb the fluid and then the salts more efficiently. So your body's actually going to absorb it. ORT alone is an effective treatment for about 90 to 95% of patients who do have acute watery diarrhea, regardless of the cause. It also does make up for that intravenous drip therapy, which you don't necessarily need in most of the severe cases. That'd be the only time that you might need it. So this oral replacement therapy also replenishes your blood with those essential electrolytes. So if you don't know what electrolytes are, you may have heard of the word, but it's basically minerals, nutrients like sodium, potassium, and chloride that are all really lost due to that intense exercise, exposure to extreme weather conditions, or diarrhea and other illnesses. So water doesn't contain any electrolytes. So ironically, water alone can't really cure dehydration like the oral rehydration therapy does. Electrolytes are super important because they do help maintain your blood pressure, allow your nerves to send and receive electrical signals, and they also help regulate those pH levels in your body, which are super important for a lot of different reasons. So what are some of these symptoms of a dehydration in adults? So signs of mild to moderate dehydration that you might want to be aware of, especially as we start to go towards those summer months, are like thirst, dry mouth, headaches, lightheadedness or dizziness, muscle cramping when you feel like you shouldn't. Like I said, headaches, decreased urination, so really dark urine, so more of like a really dark yellow, constipation, just general fatigue, and dry skin. So adults and elderly people may not necessarily notice that they're thirsty until dehydration has already set in. And when you have severe dehydration, that is really a medical emergency that you really shouldn't just ignore and say like, oh, it's fine. So when you should seek help is if you have any of these following the symptoms, where you have extreme thirst, if you have really, really low blood pressure with that extreme thirst, you have a racing heartbeat, you have rapid breathing, sunken eyes, shriveled skin, a decrease in sweat production. So you notice this a lot more in athletes, especially when they're outside, extreme fatigue, disorientation, and confusion. So what causes dehydration? So really the big thing is not drinking enough water. Exercise, as I mentioned before, hot climates. If you have a fever, diarrhea, or vomiting, that also is something else that can cause it. Chronic illnesses, and there's other substances like diuretics. Also includes alcohol, and your body can cause it causes your body to expel more urine than normal. So some common medications, such as blood pressure medications, also have that diuretic effect. So you have to just be a little bit aware of that. So if you find yourself suffering from dehydration, what do most people do? So most people think, I'm just going to grab some Gatorade, get it back into me. So these sports drinks like Gatorade, Powerade, vitamin water, they're not really designed to replenish those electrolytes to combat the dehydration kind of like they're supposed to. So the reason why, it's basically because the sports drinks, they do have lower sodium but more sugar, which really reduces the ability to deliver those key electrolytes and increase your calories in the body. So in the end, they just really don't measure up to those oral rehydration therapy that you should. So a better solution is actually Pedialyte. So if you've never heard of Pedialyte, it does contain the electrolytes as well as a small amount of sugar. Now, because they have the precise combination of electrolytes and sugars in the Pedialyte, it does help restore those fluid levels and nutrients that are lost through the sweating, urinating, vomiting, and diarrhea that you might expect with some more moderate to severe dehydration. So it is way more effective than water. Again, because water doesn't contain those electrolytes, so it's really good at treating those mild to moderate dehydration. Pedialyte is also more effective at restoring your fluid levels more than beverages, sodas, juices, or sports drinks. So if you find yourself and you're super dehydrated, especially as we get to these warmer months, Gatorade, yeah, great, but actually Pedialyte is your better option to do it. And of course, most people think Pedialyte, it's just for kids, but you can actually take it as an adult. It's super safe for all ages, which makes it super great. It's over the counter and it's pretty simple to get. So hopefully this gives you a little bit of insight about some dehydration and what to do if you find that either you are suffering from dehydration or somebody you love or anything that you've noticed it's a dehydration. This will be something that's good that hopefully can prevent you from going to the hospital. Of course, unless you need to go to the hospital, and then just go. Dehydration is not something you want to mess around with, especially if it's severe. So that's all I have for you guys this week. I will see you guys next time.